Welcome to today's video. In this session, we'll be focusing on the drainage of an infected cyst on the shoulder, a common but sometimes painful condition that requires careful management. Cysts can form anywhere on the body, and when they become infected, they may swell, become tender, and even produce pus. Today, we're going to take you through the entire process of draining an infected cyst, what causes them, and how to properly care for the area after the procedure to prevent complications or recurrence. Let's begin. Understanding infected cysts. Before we get into the drainage procedure, it's important to understand what an infected cyst is and how it forms. What is a cyst? A cyst is a sac filled with fluid, keratin, or other materials that develops under the skin. One of the most common types is an epidermal cyst, which occurs when skin cells become trapped beneath the surface and form a small, round bump. Normally, these cysts are harmless, but sometimes bacteria can enter and cause an infection. When this happens, the cyst can become red, swollen, painful, and filled with pus, a clear sign that drainage is needed. Common causes of infected cysts include trauma or injury to the area, bacteria entering through a small opening in the skin, friction from clothing or repeated pressure, pre-existing skin conditions like acne. In this case, we're dealing with an infected cyst on the shoulder, a common location due to frequent movement, friction from clothing, and sweat buildup. Preparation for the drainage procedure. Now that we understand what we're dealing with, let's talk about how we prepare for the procedure. Cleaning the area. The first and most crucial step is sterilization. We clean the area with an antiseptic solution, such as chlorhexidine or iodine, to minimize the risk of spreading bacteria. Local anesthesia. Because infected cysts can be quite tender, we inject a local anesthetic, like lidocaine, around the cyst. This helps numb the area, making the procedure as comfortable as possible. Step-by-step drainage procedure. Step 1. Making an incision. Once the area is numb, we use a scalpel or a sterile needle to make a small incision over the cyst. The goal is to open up the cyst and allow trapped pus, fluid, and debris to drain out. As soon as we make the cut, thick yellowish or white pus will start to come out, a clear sign of infection. Step 2. Expressing the pus and fluid. We gently press on the surrounding area to help expel any remaining pus. In some cases, a hemostat, a small surgical instrument, may be used to hold the cyst open and remove stubborn debris. If the pus is particularly thick, we might need to flush the cyst cavity with a sterile saline solution. Step 3. Removing the cyst wall, if necessary. In some cases, removing the entire cyst sac is recommended to prevent recurrence. However, if the infection is severe, we may need to leave the area open to allow continued drainage before attempting cyst removal in a future procedure. Step 4. Packing the wound. After draining the cyst, we often leave the wound open to continue draining. A small piece of sterile gauze, called a wound packing strip, may be inserted to absorb fluid and promote healing. This prevents the cyst from closing too quickly, which could trap bacteria inside and lead to another infection. Aftercare instructions. Once the cyst has been drained, proper aftercare is essential to ensure safe healing and prevent infection recurrence. Keep the area clean. The wound should be cleaned daily with an antiseptic or saline solution. Apply a new sterile bandage after cleaning. Monitor for signs of infection. Redness, increased pain, warmth, swelling, or a foul-smelling discharge may indicate that the infection is still present. If these symptoms appear, consult a doctor immediately. Take prescribed antibiotics if needed. If the infection was severe, the doctor may prescribe oral antibiotics to kill off remaining bacteria. It's important to complete the full course of antibiotics, even if symptoms improve. Avoid pressure on the area. Avoid wearing tight clothing or putting excessive pressure on the shoulder while the wound heals. Return for follow-up care. If the cyst was packed with gauze, you may need to return to the doctor in a few days to have it removed or changed. Preventing future cysts. To lower the risk of developing future cysts, here are some key preventative measures. Heavy checkmark, practice good hygiene. Regularly wash your skin with gentle soap and warm water. Heavy checkmark, avoid picking at your skin. Picking can introduce bacteria and lead to infections. Heavy checkmark, manage excess oil. If you have oily skin, use non-comedogenic skincare products to help prevent clogged pores. Heavy checkmark, reduce friction. Avoid tight clothing or repetitive friction on the skin. Heavy checkmark, address underlying skin conditions. Conditions like acne or folliculitis can make cysts more likely to form. Conclusion. And that's a complete look at the drainage of an infected cyst on the shoulder, from understanding what causes cysts to the step-by-step drainage procedure and essential aftercare tips. If you found this video informative, don't forget to like, share, and subscribe for more in-depth medical content. And remember, if you ever notice a cyst forming or experience any signs of infection, it's always best to consult a medical professional for proper evaluation and treatment. Thanks for watching and stay healthy.